Hi, this is Ellen Evans, the bariatric dietitian at Fletcher Allen, and I'm going to be presenting part 2 of the post-op diet for bariatrics. Progression to the soft diet, phase 4. Please turn to your nutrition booklet, page 13 for bypass and sleeve, 14 for band. During this phase, you will be eating food that has been cooked to a soft consistency, but not necessarily blended. Start slowly, adding one new food at a time. Your eating behaviors are very important and will determine whether the food stays down or comes back up. Start with very small bites. Remember the top part of your pinky? That's your guideline. Chew food very well, 20 bites or more. Put your fork down between bites to slow down. Take 20 to 30 minutes to eat a small meal or until you feel a bit of pressure that tells you to stop eating. If you eat more than that, you will likely have regurgitation. Focus on eating. Don't watch TV, sit in front of the computer, or eat in large groups at first. That may distract you, and you may eat too fast or not chew well enough. Remember never to drink liquids while you eat. Separate them by 30 minutes. Continue to use your protein supplements, either as shakes in between your meals or as added unflavored protein powder. Your goal is still 70 grams of protein per day. Progression to regular food. Page 18 for band patients, 17 for sleeve, and 20 for bypass. Band patients first. You should progress to regular or fiber-containing foods such as fresh fruits and vegetables before your 6-week post-op follow-up appointment. This will help us determine if a fill or adjustment to the band is needed. Review the foods listed on page 20 in your nutrition handbook for foods to take extra care with, as they are commonly not tolerated after surgery. Now, bypass and sleeve patients. You will take longer to progress to this phase. As tolerated, slowly add fiber-containing foods to your diet at around 8 weeks post-op. Again, review the list of commonly not tolerated food found on page 21 for bypass and 19 for sleeve. Eating rules remain the same now and forever. No drinking while eating, small bites, chew well, eat slowly, and stop after 20 or 30 minutes or when you feel any pressure or pain. Please continue using a protein supplement until you are able to eat 70 grams of protein in food. Calories at this point in time can vary, with lap banders having between 12 and 1500 and bypass and sleeve considerably less than that. It is most important to make good food choices. Eat your protein first, then eat some fruit or vegetable, then and only then, if you have room, have some starch food. Do not eat the starch portion first, as this will fill you up before you are able to eat enough protein. Remember, exercise is important to preserve your muscle mass and help you burn calories to continue your weight loss as long as possible. After your 6-week post-op clinic visit, you can increase your exercise. Be sure to get at least 150 minutes per week of cardio and some weight or strengthening as well. After surgery, you will need to take a nutrition supplement for the rest of your life. Lap band patients, please refer to the table in your nutrition handout, blue tab, page 19. Sleeve and bypass patients have a separate handout found after the numbered pages in the blue tab. Supplements are needed to replace what you will have difficulty digesting and absorbing. Iron. It's an important part of healthy blood. Without enough iron, you can become iron deficient, which causes fatigue, shortness of breath, and rapid heartbeat. Iron found in food, especially red meats, needs stomach acid to be digested, which is limited, especially after sleeve and bypass surgery. Calcium and vitamin D are necessary for healthy bones. Calcium, like iron, requires an acid environment for digestion. Without enough calcium and/or vitamin D, you can lose bone mass during your weight loss and may be in jeopardy of having weaker bones. B12 has a role in maintaining healthy blood and nerves. Your stomach produces a substance called intrinsic factor, which is needed for the digestion of B12. Sleeve and bypass patients may not make enough of this chemical after surgery. Lack of B12 can lead to permanent nerve damage with numbness, tingling, and eventually paralysis of the extremities. Multivitamins and B-complex replace what you may not be able to eat and will assure you stay in optimal health. Lapbanders start a chewable multivitamin with iron if you are female still getting your period at 2 weeks after surgery, then a chewable calcium with vitamin D at 6 weeks post-op. Sleeve and bypass patients also start their chewable multivitamin with iron for sleeves at 2 weeks and the rest of their supplements at 6 weeks. Following the doses in your handbook, you may choose any brand you want, including children's chewable. Take the adult dose, or the specialty bariatric vitamins found online at Bariatric Advantage, Celebrate, or ProCare Health. Ask the dietitian for more details if you are interested in the specialty brands. Complications for bypass. Dumping syndrome occurs because food is either too concentrated, especially sweets and fats, or too much is eaten. The new pouch dumps the food into the small intestine. The body tries to dilute the food by taking fluid out of the blood vessels and putting it in the abdomen. This can cause a low blood pressure response of dizziness, sweatiness, and lightheadedness. The extra fluid in the intestine can cause abdominal cramping and possibly diarrhea. The way to prevent dumping syndrome is to avoid sweets. Even 100% fruit juice may be too sweet. Avoid fat and excess quantity. Reactive hypoglycemia is a condition of low blood sugar 1 to 2 hours after a meal. Usually that is caused by eating too much carbohydrate and is prevented by avoiding concentrated carbs like sugars and some starches and by eating a protein with any carb. Complications of sleeve and bypass also include stretching or enlarging the pouch over time, or the reverse, overhealing, which may cause tightening called stenosis. Remember to stop eating once you feel the slightest pressure. Avoid drinking with meals, and always eat protein first as ways to prevent stretching or dilation. Stenosis can be corrected using endoscopy. Leaks are very rare but very dangerous and can be fatal. If they occur, it will be in the first few days after surgery. Possible complications of the lap band include lap band slippage, which can be caused by excessive regurgitation or vomiting. Be sure to follow the post-op diet progression and avoid intolerances by practicing good eating behaviors. Blockage of the outlet can happen if food is not chewed well. Erosion of the band into the stomach means the band must be removed. As time goes on, your weight loss will slow and eventually stop. If you should begin to regain weight, use the weight reduction principles you are learning preoperatively. That is, avoid excess calories in sugars and fats, avoid grazing, don't drink your calories, and don't drink while eating, Be sure to get enough exercise. Restarting food logs helps identify what you are doing so you can take corrective action. If you continue to gain weight, make an appointment to see us in clinic, and we will help you get back on track. Coming to support group also assists in staying focused. The next 3 slides are for lap band patients only and review the adjustment cycle. It's important to remember that your lap band has no fluid in it after surgery. The restriction you feel post-op is almost all due to the post-op swelling and gradually goes away over the next month. By the end of the month after surgery, you may feel no band restriction whatsoever, and that is not uncommon. It simply means you need fluid in your band. Please read the information found in page 2 and 3 in the blue tab of your nutrition handbook. You are eligible for your first adjustment 6 weeks after surgery. Be sure you have progressed your diet to a regular diet so we can properly assess the status of your band. You need more fluid in the band if you feel no sensation when you eat, especially if you eat too fast or don't chew well enough. You are able to eat more than a small portion of food. You are hungry between meals, or you are not losing weight. The band is not designed to make you feel full like after Thanksgiving full. It simply will help you be satisfied with a smaller amount of food. If you drink with meals, have calorie-containing beverages, or really soft food, the band may not work for you, as food will flow freely through the band without any sensation. Make sure to document your intake so you stay on track with calories. Exercise and eat plenty of protein and high-fiber food to help you control your hunger. We will see you monthly for fills until you have adequate restriction. You should call us for an appointment if you ever start feeling hungry again, or if you begin to have multiple regurgitation episodes, which means you may be too tight. After each adjustment, you will be on a short post-fill diet, starting with clear liquids the day of the adjustment and progressing to regular food over the next week. We will be reviewing this adjustment information at every post-op visit. Please call or email me with any questions you might have. At your next clinic visit, we will discuss the blended diet homework assignment and you will take a quiz. See you in clinic.